super excited. I'm gonna bring it back a little bit, okay? I'm gonna keep everything very natural the way you want it. I'm gonna draw back, make sure we're not in the wrong area. Now I'm going to put a little bit of product in there, very subtly. So right now, what I'm doing is just putting filler on the sides to help bring out her lip a little bit because it was a little bit turned in. And then I also put filler on the sides to outline her lip line. So that way when she puts on her lip liner, it'll make it look a lot more pretty and pop a little bit more for her. So what I'm doing here is these little places where she has little indentations. I'm filling those and then injecting and pulling out. So that way it brings her lip out a little bit more and fills in those little gaps. So I'm gonna do another one right there. I draw back to make sure I'm not in any wrong area. If I am, it'll give me some blood and I know I'm in an area I shouldn't be in. You see how that filled in that little gap for her? That's what I'm doing. The last thing I want to do is kind of make her little cupid's bow come out a little bit more. So I'm going to come around this area and put a little bit of filler there and it'll make it pop. Bleeding and bruising is very normal. So I would say typically about 1 to 2 weeks she might have a little bit of bruising and swelling, and then that will subside. The filler is going to last her maybe about 8 months to a year. If she exercises, it could metabolize it a little bit faster. Now we do ask that any patients that are planning to get filler, they avoid any fish oils, any garlic supplements, any diet supplements, anything that can possibly be blood thinning. Those typically cause more bruising and swelling. And I'm just massaging the product around. So this product is called Wrestle and Kiss. It helps lift and rejuvenate her lips. So it just gives volume to the lips. Very, very nice product that you can mold in different areas. So if I inject it here, I can move it around and it'll go to a little bit to the side. And all the fillers that we like to use are hyaluronic acid fillers. So if for some reason you didn't like the product or whatever reason, we can always inject a little Hylenex and remove it right away. We can always add more, but just starting off subtle since that's what you're wanting.
Yes.
I think this suits you, but when you're ready, I would like to go just a tad bit bigger. Now in 2 weeks, if you can come back, or maybe like in a week and a half, and we can assess, let your swelling go down a little bit, and then if you're ready to put more, then we can.